Vitamin D and vitamin K are two essential nutrients that most people hear about in a positive context. They support bone health, immune function, and overall well-being. However, these vitamins are not always harmless, especially when taken in high doses, taken together without understanding individual health status, or used by people with specific medical conditions. Understanding when vitamin D plus K can become harmful is crucial, particularly for those who self-supplement, older adults, or anyone with chronic health issues. The first dangerous situation arises when someone has high calcium levels, hypercalcemia. Vitamin D increases the absorption of calcium from the intestine and mobilizes calcium from bones. While this mechanism helps maintain healthy bones at normal doses, research has shown that long-term supplementation of vitamin D increases the risk of hypercalcemia and related conditions, even in doses that aren't considered extremely high. A systematic analysis of randomized trials found that participants receiving vitamin D supplements had a significantly higher risk of elevated blood calcium and calcium in the urine compared with those on placebo, indicating a real increase in calcium-related side effects. Importantly, this elevated calcium doesn't just disappear. It can accumulate in soft tissues, contributing to symptoms such as confusion, abdominal discomfort, nausea, excessive thirst, frequent urination, dehydration, and even cardiovascular complications like irregular heart rhythms and high blood pressure. These serious symptoms of hypercalcemia underscore that too much vitamin D is not always safe. A related point of danger is in individuals with pre-existing kidney disease. The kidneys play a central role in regulating calcium and converting vitamin D into its active form. In people with impaired kidney function, such as chronic kidney disease, CKD, stages 3 to 5, supplemental vitamin D has been shown to raise serum calcium levels without clear benefits in reducing mortality, fractures, or cardiovascular events. In fact, evidence suggests that these supplements may be linked with increased calcium absorption and hypercalcemia in those with low kidney function, because the kidneys cannot adjust calcium and phosphate balance as effectively. The decreased clearance of vitamin D in kidney impairment means even standard doses could push calcium levels higher than intended. For elderly people with declining kidney function, this risk is particularly important. The same mechanisms that make vitamin D beneficial in healthy individuals can make it harmful in those with kidney impairment. A third major risk group includes individuals taking blood-thinning medications like warfarin or other anticoagulants. Vitamin K plays a direct role in blood clotting by activating proteins that help form clots. When someone is on blood thinners, sudden increases in vitamin K intake, especially from supplements, can counteract the effect of medications designed to prevent dangerous clots. This interaction may reduce anticoagulant efficacy and increase the risk of clotting events. While vitamin K is generally safe at ordinary dietary levels, high supplemental doses taken without medical supervision can be unpredictable in people on these medications. This interaction isn't always intuitive to the general public, so it's one of the reasons clinicians recommend careful monitoring of vitamin K intake when people are prescribed warfarin or similar drugs. The goal is to maintain a consistent level rather than unpredictable spikes from supplements. The fourth dangerous time is when people take very high doses of vitamin D without blood testing or medical guidance. Vitamin D toxicity, also called hypervitaminosis D, is rare from sun or food sources alone, but is well documented with excessive supplement use. Clinically significant toxicity often arises when blood levels of 25-hydroxyvitamin D exceed standard ranges, often above 100 to 150 nmol, and is most frequently due to prolonged intake of large doses, particularly those exceeding 4,000 IU daily for long periods. Symptoms of toxicity may start subtly with gastrointestinal issues, nausea, vomiting, appetite loss, general malaise, weakness, fatigue, and neurological symptoms, confusion, trouble concentrating. Left unchecked, the resulting high calcium levels can damage key organs, including the kidneys and heart, cause pancreatitis, increase blood pressure, and even led to arrhythmias or structural heart issues. Recent clinical observations highlight cases where elderly patients developed severe hypercalcemia and accompanying symptoms because of uncontrolled high-dose vitamin D supplementation, emphasizing the need for careful dosing and regular blood testing before and during high-dose use. A fifth point of harm occurs when individuals take vitamin D and vitamin K supplements unnecessarily, especially if they already receive adequate amounts from their diet and sunlight exposure. Many people living in regions with sufficient sun exposure or who consume nutrient-rich foods, like oily fish, fortified dairy, leafy greens, and fermented foods, already maintain healthy levels of vitamin D and vitamin K. Adding supplements on top of this, without checking baseline levels, can tip the balance toward excessive intake. While most cases of mild oversupplementation may not cause immediate crisis, prolonged, unnecessary intake increases the likelihood of cumulative effects such as elevated calcium, vascular calcification, or interactions with other nutrients. For example, an overabundance of vitamin D may reduce vitamin K2 levels, which are important for correct calcium placement in bones. Without enough K2, calcium may deposit in blood vessels instead of bone, contributing to cardiovascular risk. This underscores the importance of individualized supplementation based on blood test results rather than blanket high-dose usage. Another situation often overlooked is related to older adults and seniors. While many older people take vitamin D supplements to combat deficiency and protect bone health, seniors are also more susceptible to adverse effects. Age-related changes in metabolism and kidney function mean that the elderly often clear vitamin D and calcium less efficiently than younger adults. Case reports highlight elderly individuals developing delirium, muscle weakness, severe electrolyte imbalances, and other serious symptoms after excessive supplementation without proper monitoring. Caregiver-administered dosing mistakes in elderly populations have been noted as a specific risk factor, suggesting that both patients and caregivers must be vigilant about dosage accuracy and follow-up testing. Additionally, while vitamin D can reduce fracture risks at moderate levels, extremely high doses offer no additional benefit and can increase risks of calcium deposition outside bones and kidney complications. This is especially relevant for older adults who frequently use multiple medications, polypharmacy. Their bodies may react differently to supplements compared with younger, healthier individuals. Finally, although vitamin K is often thought to balance some risks of vitamin D, particularly by directing calcium into bones and away from soft tissues, the evidence for this protective effect remains mixed. Some studies suggest that vitamin K1 or K2 may influence biomarkers related to vascular calcification, but clinical outcomes like reduced mortality or clear prevention of calcification aren't consistently demonstrated. In certain contexts, vitamin K supplementation raised calcium levels moderately without clear evidence of reducing harmful calcification. In other words, adding vitamin K doesn't automatically negate all risks associated with high vitamin D intake, especially when doses are unmonitored or when people have underlying conditions like CKD. Therefore, vitamin K should not be used as a fail-safe to justify high vitamin D dosing without careful professional oversight. In summary, while vitamin D and vitamin K are vital for health, there are several scenarios where their supplementation can be harmful. These include individuals with high baseline calcium levels, those with compromised kidney function, people on blood thinners, anyone taking excessively high doses without medical testing, older adults who may metabolize nutrients differently, and cases where supplements are used unnecessarily, or in hopes that vitamin K will cancel out all risks. The consistent theme across research and clinical experience is that supplementation should be personalized and monitored, particularly for high-risk groups. The safest approach to optimizing vitamin D and K status involves baseline blood testing, discussion with qualified healthcare providers, and careful attention to dose, duration, and individual health conditions. This way, you can reap the benefits of these nutrients without inadvertently creating harm.